I wonder if we could do our intro on Zoom. Is that possible?
Hey,
Mama,
mama.
I don't know if it's gonna work out. That's how we had to do it. That's it.
Just two moms on a mission to comprehension.
Welcome to Momprehension. We're so excited. And we have a guest today, and her name is Alex, and we're gonna bring her in now.
Yay.
Yes.
Hey, perfect.
I'm here.
Yay. The woman of the hour.
I'm here.
We're already recording, FYI.
My headphones said recording in progress, like as soon as it popped up. So I was like,
You are being recorded.
Be warned. Be
Yes.
warned.
watch out.
This is Alex, my friend of, we realized earlier this year, I was like, I gave her like a reference and they were like, oh, how long have you known Alex? I was like, oh, I think like maybe like 6 years. And then Alex was like, no, girl, it's like 10 years. I'm like,
Like
what?
10.
And Alex, I'm like, you introduce yourself, what you do. And that way we can have some, if we have some questions, we'll ask you.
Sure. Okay.
Yeah.
So my name's Alex Ryan. I am a mom to 3 kids. They're 5, 4, and 7 months. I have been a lactation consultant for about 4 years, and a doula for about 5 years. And I just, live in the mom life, I guess.
That's awesome. I didn't realize you were a doula too. That's so cool. Did you
Yeah.
have your 3 kids at home or at a
No.
birthing center?
So I didn't get to do that because I'm high risk. So I wasn't able to deliver at home or in a birthing center. But I did do all of my deliveries with a midwife at the hospital.
Okay.
So that was
I wanted the same. I'm high risk too, so I couldn't
Yeah.
do it either. But that would have been the dream. I would have loved
Yeah.
it.
I thought about it. I really wanted to, and I considered it with my 3rd because I was like, man, I've done this a couple times.
Mhm.
Maybe I'll be okay. But I actually was the most high risk with her than
Oh.
the other 2, because I ended up with hyperemesis gravidarum, the very severe morning sickness that like makes you lose weight and all of that kind of stuff. So for the first like 14 weeks, I was actually losing weight, and I didn't gain any weight until like the 3rd trimester because I couldn't eat. And so they had me hooked up to all these fluids and medications and things like that, like 24/7. And it actually gave me like a heart problem because I was so deficient in like nutrients and things like that. So they had to watch me the rest of the pregnancy once I was able to start like eating and weaning off of the medication, because it didn't resolve till after she was born. So with
Wow.
her, I was actually terrified to give birth because I was like, oh no, something bad is going to happen to me.
Right.
But her birth was completely uneventful, like just easy peasy. My midwife was amazing. Hospital setting was like very quiet, easy, relaxed. But her pregnancy was like
Yeah.
the
Complete opposite.
Yeah.
Poor.
The
Yeah. Do you
opposite.
have any like recommendations for people who have?
Yes. Oh my
that?
gosh. Yes. Okay. So with my first son, I had hyperemesis as well, but I was a first time mom and I was 21 and nobody believed me. They were just like, oh, eat some crackers and you'll be fine. It's no big deal. And I got hospitalized like 4 times before I was even 11 weeks with him because I couldn't even drink water. Like it was so bad. With my second son, I didn't have any hyperemesis at all. I didn't even get sick, which was wild. But then with my daughter, I got pregnant with her, and it was like the 2 lines showed up and I was in the bathroom. Like there was no, it was so quick. It was so like exhausting and horrible from the beginning. That I had a new doctor who Evette referred me to actually a few years ago. And as soon as I called him and I was like, I've lost 10 pounds, like I'm only 7 weeks pregnant, I can't do this. Immediately, he called me back and he's like, I sent in for home health, like a home health nurse to come to your house. And they're going to hook you up to fluids. They're going to give you medication through the IV. And they're also going to do what's called a Zofran pump, which is kind of like, imagine like a Dexcom, kind of like for people with diabetes, where you just stick it on yourself and then it gives you medication every once in a while to make sure that you're okay. Same idea, but I had to stab myself like once a day with a little stick thing, and then I would hold it in that area for the whole day, and it would continuously give me nausea medication because none of the medications were working orally. So they had to keep doing that, and you can't just have an IV like all the time.
Just walking around like
So I had a little
Grocery
fanny
store.
pack. I had a little fanny pack with my little cute medical device in there.
She did.
It was very,
Wow.
very adorable. And then every once in a while, the home health nurse would come and give me fluids if I was having like a particularly bad day or something. But that saved my life. That saved my life. I was able to play with my kids. I was able to sleep. I could eat food. I still didn't feel great. I still had that kind of like nauseous feeling in my mouth all the time, but it was, I mean, leaps and bounds different from the last time. So what I say is if you are that sick, if you are throwing up, or if you're so nauseous that you can't eat, or like when you put things in your mouth, you can't swallow, any of that, it's all hyperemesis. If it happens, all day long, constantly, that you ask for a home health nurse because it's covered under like every single insurance plan.
Get out of here.
Yeah, I had no idea.
Wish
I was
I had
like,
known that.
it was even covered under Medicaid because I asked specifically, Medicaid I know is really hard and sometimes no, fully covered.
Wow. And the
So-
fact that people, I mean, doctors obviously know this. Like, why not just, there's so many women I know that get like so ill.
I
and
know.
it's like,
I have no idea why this hasn't been a thing because I have a friend who had a baby 7 years ago and she also had this pump going. So it's been a thing for many years,
right.
but most doctors just, think, oh, well, once the first trimester's over, she'll be over it. Or there's a lot of doctors that still don't think that it's that bad or, all of that. Whereas there's these women going in, or they just say, go to the ER, get fluids. Go to the ER and get fluids. Go get fluids.
Let's
And it's
spend
like
thousands more dollars.
thousands of dollars and also just barely keep you alive. Like,
right.
It doesn't make you feel okay. It just keeps you alive. Like that's it. So that is, I highly recommend looking into it, figuring out, when you're looking for OBs before you get pregnant, things like that, talk to them about those kind of things. If you are interviewing OBs or midwives, or if it's your second pregnancy and you were really sick with your first and you don't like the way you were treated, make sure you bring that up from the beginning. Hey, I got really sick. Do you refer out to home health for that kind of thing? So that ahead of time, you're not fighting for the care.
Can you tell us a little bit about like the BRCA gene and what that's about and how that actually affects breastfeeding? Is that what made you like want to become like a breastfeeding consultant and all of that? Or like what made you?
Yes.
Mhm.
But basically what it is it's not that you have the BRCA gene, it's that you have a mutation on your BRCA gene. So like everybody has a BRCA1, a BRCA2 gene. It's just some people have specific mutations that make them more likely to get certain types of cancer or to have certain traits and things like that. So for me, basically I have a family history of cancer on both sides. Like on my dad's side, on my mom's side, everybody's got, from brain to thyroid to uterine to breast, like all over the place. So I went in when I was 20 to my OB and it was a new OB. And I was like, hey, I'm here for my regular well visit. But she had read all of my paperwork because I filled out all that giant packet when you first start with a new doctor about your history and all that. And I had put that, lots of cancer on both sides because they always ask you like family history of cancer and it's like a tiny little line. And I was just like, lots of it everywhere. So, cause I don't know, I can't write everybody down. Like that's
Right.
insane. So she was like, what does this mean? Can you talk to me more about this? And so she's like, I want you to give me a list and I'm going to write down like all the different people. Okay. So we sit there and I go through all the different people, all the different types that I know. Cause like it's aunts and great aunts and different things. So I was like, I know that there's, this, I don't know a lot about it. Anybody that I had more information, I gave her more, whatever. So at the end of that, she's like, okay, thanks, does the whole visit. And then she goes, I really just feel like you should have genetic testing done. And I was like, okay, whatever. Like, is it covered by my insurance? And she's like, yeah, because you have such a large family history. I just put that in the notes and your insurance will cover it. Okay, fine, go for it. Do whatever you want. So I go on with my life for like 2 weeks, totally forgot about this because she just drew the blood in the office and sent it off. Totally, completely forgot. And so she calls me like 2 weeks later and she's like, hey, I need to talk to you about your blood results. And so she goes, you actually have one of the things that I was worried about you having. You have a gene mutation. And so then she goes into this whole long like spiel, basically like a telehealth visit, telling me, this is what it is. This is what it means. So thankfully she referred me to a breast surgeon who had availability like that week. So I was able to get in and go talk to her, and also a geneticist who was able to like really break down for me all the different things that were going on. So basically they said, hey, look, you have BRCA2, which in itself puts you at like an 87% lifetime risk of breast cancer. And that means over your lifetime. So there's an 87% risk, every 87% chance risk that by the time you're 80, you're going to get breast cancer at some point between all that time.
That's insane odds.
I know. So I was like 87, that's it. And she goes, well, and because your other side that doesn't carry the gene also has all of this cancer, it increases your risk to be higher. They didn't have an exact number for me because they're like, we can't exactly give you that based on just the family history, but it does increase your number. And it also increases your risks for a plethora of other cancers, which include like ovarian, uterine, and things like colon cancer and pancreatic cancer and all that. So she gives me this whole long like list of like, okay, here, 10% this, 60% that, like all these different cancers. And
Devastation. Like, you had to be like devastated. Like it was.
Well, I'm 20 years old. Like,
right.
I'm living with my then boyfriend. I'm going to college. Like, didn't even like cross my mind that something so like big was going to just fall out of the sky after I go to my OB appointment. Like, it wasn't something it wasn't like my family talked about it and we all knew, and it was something you test when you're 18 and everybody's informed. It was nothing like that. It was just, here you go. Here's all of this information. So once I was given all of that, I talked to the breast surgeon about like options, because they were like, breast cancer is the most pressing problem that you're going to face, as well as ovarian cancer, because that one was like in the 60 something percent. So they said, your options basically are every 6 months you do a mammogram or an MRI. They alternate back and forth to just see what's going on. You do a baseline one, and then you go from there to see if there's any changes and to monitor to make sure nothing happens. And it's every 6 months because people who have a BRCA gene mutation are more likely to get aggressive, fast forms of cancer. So they want to make sure they're checking on you pretty often to make sure that that doesn't happen. And then also doing monthly self-exams.
And by the way, here in America, like I know one time I had like, some breast pain or something, and they were like, oh yeah. And even my doctor tried to be like, don't you have a history of breast cancer? Like to try and like get the like insurance to pay for it. I was like, yeah, they still don't pay for it. Like they're like, that doesn't count. You get like your one free mammogram a year after, what is it? Like
40.
age 40. If you're under the age of 40, forget it. Like you're paying every time you get that mammogram done, every time you get the MRI done. And they are not cheap.
They're not.
No. It's insane.
My first MRI was like $500 something because even with the gene mutation, they will only cover once a year. They don't cover every 6 months. So my first MRI, and because I had just found out and all of that, I ended up having to pay like $500 something, which for a 20-year-old in college was like, oh my God, I'm like, how am I going to do that?
Insane.
Crazy. Yeah. And so I got my first MRI. I went back to the breast surgeon and they were like, hey, look, you can do this every 6 months and do these breast exams and panic for the rest of your life, basically. And she mentioned that if I was going to have kids and breastfeed, that during breastfeeding, you can't do any of these images because they won't be able to see because the milk blocks the images on the screen. So they can do like, imaging, but it's not going to be very telling because there's going to be a lot of blurriness. There's going to be a lot of, problems in the images. So they said, hey, if you are planning to have children and breastfeed, remember that you will not be able to have mammograms or MRIs while you're pregnant and while you're breastfeeding. So I'm thinking, okay, if I'm pregnant for 9 months and then I breastfeed for at least a year, if not more than that, that's 2 years each time I have a child that I don't get to be monitored at all, which is horrifying.
Isn't breast cancer also like fed by hormones?
Yes. So some types are fed by hormones, depending on, what type it is. Some of them, they say that breastfeeding can lower your chances of getting certain types of cancer because you're using the tissue and it's doing what it's supposed to do and things like that. So there are certain types of cancers that are a lower risk. However, you are at a higher risk of getting breast cancer when you're pregnant because of the hormones. So
Right.
it's like, it was this kind of like, okay, so I just have to choose to either like only have one child or like be panicking for 2 years every time I have a child because of this thing going on. And they said my other option was to go on chemo preventative drugs, which is basically like, it kind of puts you into like an early menopause sort of, and it just shuts down your hormone production to keep any kind of hormone cancers from showing up.
That's
And
while you're breastfeeding, you can do that?
no. This is just an
Oh.
option that you can do instead of monitoring and
Oh, but then what are your options of pregnancy if you're like on
you can't.
hormone? Right.
Yeah, you would have to stop that for like a certain amount of time before you could even start trying to get pregnant because of the risks of birth defects and things like that. So that was the other option. And she's like, I don't give that option to people that are like of childbearing age. That's typically like 45, 50, 55. That's something that they would give somebody of that age to do as a preventative. But she's like, it's really not something we do often. I just want to like, read out all of your options for you. Okay. And she's like, the other option is a preventative mastectomy. I'm like, what is that? I don't know what that is. She's like, basically what they do is they go in underneath, your breasts or through the nipple, depending on what type of procedure you get. And they just cut out all of the breast tissue from your collarbones to like the bottom of your rib cage. And they just scrape everything that they can possibly find out of there, like an amputation of your breasts. But obviously, since I know all about this, that's what I did. I went and I said, no, I am not. I want a couple of kids. I want to be able to not be panicking about this the rest of my life. I'm a high anxiety person.
You
I
already
cannot
have
handle this.
anxiety when you're pregnant already. Like,
Yeah.
so you don't need double anxiety.
I can't handle it. I was like, I can't. The first night after I found out what I had, I started obsessing and I started like checking myself daily, and I was absolutely a wreck. I didn't even want to look at myself in the mirror because I was terrified. And so, I talked to her and was like, okay, just take them. I don't need them.
And so then how did that lead into, well, I know like you always loved kids and were like loved
Yeah.
babies. So I understood the doula thing.
Yeah.
And by the way, Alex, what doulaed for me, I think I was your first one, right? Was I your first? Yeah, I was her first. So it wasn't a good experience though.
Well, it was like a
horrific.
4-day induction. So that was a little difficult.
It was
for you.
It wasn't the best, experience. And I know Alex was like, girl, we got to do something. Like it was rough.
And I know more now too about, induction process and things like that. But I mean, you were exhausted. There was not much that I could do for you because you were so tired. Like
it was rough.
It was rough. And
there was like no food involved.
For days, you were not allowed to eat.
For days, yeah. And then the medicine just I wasn't reacting well to it. Was bad. So Alex was like, I'm sorry. And I was like, don't be sorry. It is not your fault. It is totally everything that came from the birth. So I get the whole like the doula thing, but then when you change to breastfeeding too, like I know you wanted to add that, which is an amazing. I was like, wow, yeah, duh, doula and breastfeeding consultant. So like you're there for the birth and then immediately hop into breastfeeding. And like, but I also was like, okay, does that link also to the fact that she had this BRCA like gene mutation?
Yeah.
Was that all?
Are you able to breastfeed after having the preventative
mastectomy? Yeah. So no, but I will explain. So basically, when they cut out all the breast tissue, there's no milk ducts. They cut those out too. They're gone.
That's what I would have assumed.
Yeah. However, since I did a nipple sparing mastectomy, there's a little bit of tissue left behind there because they have to allow for blood flow to the nipple because otherwise it'll die. Like, they have to allow for blood flow to the skin and to the nipple. So they have to very carefully go around when it comes to that. So basically, how I got into the breastfeeding is I became a doula when I was pregnant with my first son. And then when I was in the hospital with him, I had a really hard time accepting that I wasn't going to be able to breastfeed. I knew that the mastectomy was the right choice for me. However, I I cried. I spent a lot of time dealing with that because I am the oldest of 5. I was there for the birth of my 2 youngest siblings. My mom breastfed. I was around this kind of whole thing for a long time, and it was really important to me to breastfeed. And so I was very devastated about that. I knew, though, if I chose to breastfeed and then got breast cancer and wasn't there for my kids, it wasn't going to be worth that to me. So I knew that I made the right choice, but I still had a lot of like trauma and sort of guilt over
It was
the
a
whole
loss.
thing. It's a
It was a
lot.
loss.
Yeah, it
Yeah.
was. And so when I went in to have my son, I had like a sign made for my door that said, non-breastfeeding mom, like mastectomy, do not send the lactation consultant in here, whatever. Because I was like, I can't talk about it too much. And you know what happened? Everyone talked to me about it.
Oh no.
Everyone.
With the sign?
With the sign. I had a
Just
sign.
ignored it? Just like, no breastfeeding. Okay. Hey, mama, you want to breastfeed?
I'm telling you, my mom was there because my mom and I got our doula certification together. So she was my doula for all 3 of my kids.
Aww.
But she was there, and she, like the 3rd or 4th time somebody said, like, are you planning on breastfeeding? My mom was like, is anyone looking at her chart? Like, she was so mad.
Yeah.
She was so mad. And my husband was like very upset for me because he knew like how upset I was. And she's like, if one more person comes in here and asks my daughter about breastfeeding, I'm going to the hospital director and I'm going to talk to that. She went off. I could hear her in the hallway doing her thing. She's like, don't say another word. And I'm in the room crying because I hadn't even had him yet. I'm in labor.
Oh, now they're asking even before you get.
Because they want to know, like, should they get formula ready, or like, do you need a
But
lactation
if you have
consultant?
it on the door, it's like
Nobody looked. Nobody
like
looked.
having a can't eat. What do they call it? A
NPO.
NPO,
like
and walking in with a burger. Like, hey,
Yeah.
like, no.
It was absolutely awful. So, anyways, nobody asked me after that. Thank God. But I had donor breast milk for my son. So somebody had told me about that when I was pregnant, because I was researching formulas and I was like, what are we going to do? You know, whatever. And then a friend of mine was like, have you thought about doing donor breast milk? And I was like, what is donor breast milk? And so then I ended up connecting with a couple of moms who were extreme overproducers, who were able to basically just donate all of their extra to me. So my son was able to get donor milk, which I thought was like amazing. So that was my first kind of like, oh, wow, there's some cool stuff with breastfeeding that I think is interesting. Like that's sort of where it started. So I brought donor milk to the hospital. And again, they were storing my donor milk in the hospital freezer. So I'm like, no, it's in the freezer.
Right.
No, stop it. So he was born, obviously, and then I was feeding him the donor milk. It was going super well. We were doing skin to skin, whatever. And so then I get a knock on my door, and it's a lactation consultant for the hospital. And she's like, hey, introduces herself, and I like cut her off. My mom had gone home by this point because it was, you know, whatever. So she's not there. My husband is passed out asleep on the couch. So I'm alone now being introduced to the lactation consultant. And I was like, I'm going to stop you right there. Don't say anything else. Like, I don't need your help. Thanks so much. See you later. I was done. And she goes, I know about your situation. And I also thought maybe she was coming to like get mad at me about the donor milk, because a couple of the nurses had given me kind of a hard time about it because they were worried, you know, oh, where'd you get this from? And all of that. Okay. Totally understandable. But I had gotten it from friends. And then if it wasn't friends, it was like friends of friends who I had like background checked, basically stalked them all over the place, made sure they were not fake people, all of that, whatever.
Right. At one point in time, it was me.
And it was that, yes, I was going to get to that, the she-fed Rowan. My second son.
Yeah.
So, but yeah, so it was people that I knew, or people that were other moms, like in groups that I'm in or whatever. And I would always talk to them extensively. I would ask them what medications they took. I would, all of those things. And so I thought, okay, maybe she's coming in to like ream me for the donor milk. Fine, whatever. And she goes, no, I know about the donor milk. I love that. And I was like, okay.
Right.
Okay, you love that. And she goes, I have an idea and I just want to see what you think. And I'm like, okay, I'm open to it. I get it. She knows my situation. She understands what's going on. And so she explains this tool to me. She goes, there's this thing. She goes, I don't have this tool at the hospital, but I did look online and I saw that there's a store that carries it like 20 minutes away. And I wanted to know if you would be open to trying something with me. And I'm like, okay. So she found what's called a supplemental nursing system. And these are typically used for moms that are underproducers that want to continue to breastfeed, but they need to supplement. And it's like a tiny little tube, like a spaghetti noodle, and it hooks up to the end of your breast, like a nipple. And when the baby latches and they suck, the formula or donor breast milk comes through the tube as well as the breast milk from the mom. Okay. So she goes, I know that you had a nipple sparing mastectomy. So how would you feel if we put the donor milk in the container and then we latch the baby so that you could have the benefits of breastfeeding since you can't breastfeed? And I was blown away. Like, what do you, I can breastfeed. Like, I could do this thing that I've wanted to do this whole time. And, you know, she was very sweet. And so my mom, I call her, she immediately like books it out to this store. It was like a baby store or something like that. She goes and gets it and she comes back up to the hospital and the lactation consultant's like taping the stuff to me and we're doing this whole thing. And my son instantly latches, like instant, and everybody's crying. Everybody in the room's crying. It's tears
so emotional
everywhere. Yeah. It was beautiful.
Because there are you hit on it, but there's so many benefits for mom to breastfeed. Like it helps in the healing. It tells our bodies I don't remember
contract.
Right.
Oh,
like, you know, it's like this way of communicating, mom and baby, like subconscious psychic way of communicating. That gives both what they need. So that's so cool that I didn't know I'm thinking of like the Meet the Fockers. Is it the Meet the Fockers?
Oh, with the boob?
That's what I'm imagining. But, which seems so silly, but it's really cool that like something like that actually exists
it's
and
a real
works.
thing. Yeah. So it was shocking to me that could happen. But yeah, so he latches, we're all crying. And then when he latched, I got that like hormone rush that like all over. And I was just like, this is the most amazing feeling in the entire world. Oh my gosh, I love this. And so I did that with him for, I mean, probably 1 or 2 feedings a day because it was really hard to like get it set up. And I did start contracting too. All of a sudden when he was latching, I was like, oh my God. And I wasn't ready for that because nobody had warned me because I wasn't breastfeeding. So she goes, oh yeah, you're going to get contractions. Like out of nowhere. She's like, oh, just
you're
so you
gonna
know.
feel like you're in labor again.
Yes.
I kept telling my nurse, I think I'm still in labor. I'm still in labor. She's like, no, it's normal, but it hurt like labor.
Yeah, the cramps are for real.
They are for real. Maybe that's why you get that rush, that oxytocin rush to like make you not think about the fact that you're cramping so hard. Oh my gosh.
So that's what led you into like, breastfeeding.
Oh, wow.
Yeah.
I remember
cool story.
Alex bringing that to me when I was having difficulty. I don't know, I didn't produce for like 5 days and I kept going and I would call Alex crying. It's not working. I mean, days. I think what Alex explained to me was just like, you had such a rough pregnancy, a rough birth, delivery, everything was just so bad that my body just like wasn't ready yet. And I mean, I was like pumping and latching for like 5 days. I was like, it's not working. And Alex actually did bring me some of her donor milk. I remember that, which was just awesome because now we all know fed is best, right?
Yes.
So I'm not saying anything about formula fed. Like if you want a formula feed, you know, more power to you. Do that, but like, you know, in my eyes, like breastfeeding as well as with Alex was like something that I was like, I really want to do this, which by the way, I never got to do because I had to exclusively pump. She brought me that contraption and she was like, try this. And I was like, this isn't working. Like, and it was just the fact that he wasn't watching. It just was, it was just it was really hard
with you for one, because I hadn't had breastfeeding training yet. I had a little bit from my doula experience, but when you had Ezra, I did not have my
I was her
training.
first for everything.
Basically, when Ezra was born, it was like 2 months later that I got my certification. So it was pretty I knew a little bit, but not enough to like really help her. Now I know. I always think back and I'm like, oh, we could have tried this and whatever, all the different things. But I didn't know that then. But yeah, so and she wouldn't ask me for donor milk either. I was the one that I was like, Evette, I'm bringing it to the hospital. And you can use it or not use it, but I'm bringing it up there. And she was like, I don't want to take it from you. I'm like,
well, because I know it was so hard for you to get it. And I felt so bad. And I just remember at the hospital at one point, I think it was like day 2, and they were like, squeezing the crap out of me. And I was like, listen, just get the formula, because it's not happening. And he's hungry. Like, just get the formula. I don't care at this point in time. I just want him fed. But then Alex did bring me the donor milk, which was nice. And then I started producing my own. And then it felt like so nice to be like, I can replace this that I did times 8.
Yes. Literally.
So,
trash bags full of breast milk.
Because I, exclusively pumped. So
all the things you did in those first 5 days, like continuing to pump, continuing to try and latch him, that is what gave you that good supply, is that you kept going and you didn't stop, which is amazing. Like, you took a break for like, a few hours to sleep and things like that. But because you kept doing all of those things, your body did eventually go, oh, okay, I'm here. Like, here's all this milk.
Yeah.
So
Evette, you were such a rock star, because I got pregnant a few months after you. So you had Ezra and then I had Lucas, and I was able to with him, he was little and born very small. So I had some problems. I did have to have a lactation consultant come out after the hospital. The one at the hospital, they would just like come in, and he'd latch for 10 seconds and they'd be like, good. And he'd leave. And then, when I got him home, like the first 3 days, he just wouldn't eat. He wouldn't latch. So I had somebody come in. It was the best money I've ever spent. I never had another problem. She just taught me that like it's instinctual and here's what he's doing. And it was amazing. We never had another problem. I remember thinking, I cannot believe Evette is feeding her baby and having to pump. That is so much work. It is so much work to pump. What, 3, 4, 5 times? How often did you even have to do it?
Oh gosh. So exclusively pumping is not for the weary.
No. And everybody who's not weary after having a baby.
Right. It takes a lot of patience and, a dedication. And because I was so dedicated to my son having breast milk, and like I said, I'm not knocking anybody who does formula, like do it, but that's just what I wanted to do. The work behind it is definitely a lot. So when you first of all, I remember the first time that something came out, because I literally it got to the point where I would pump every 2 hours. Like Alex told me, she's like every 2 hours you gotta like stick that pump on. And it was like, and it got to the point, like in the beginning days, that I wouldn't even attach the bottles because I knew nothing was going to come out. But I would I would still pump. Like I would still like, okay, nothing's going to come out, but here I go. I'm going to do it. And I'll never forget the one time that something did come out. And I didn't have the bottles attached to them. And all of a sudden, like my leg is wet. And I'm like, why is my leg? Oh my God.
I remember this so vividly because I was either there or you FaceTime me or something, because I remember you being like, it's on my leg. And I was like, what? And you're like, I already get the bottles. Like you're like screaming. Like, oh my God. And I was so excited. I literally could not breathe. I was so excited.
Yeah.
Like, because I got the milk. It's here.
Yeah. It was because it was a good 5 days. It was a good 5 days. Yeah.
I want to mention that it is very common for C-sections and long inductions to lead to 3 to 5 days for your milk to come in. That is very common, and moms are not told that, but it's extremely common when you are pumped full of fluids and medications, or if you have a C-section, especially like a crash C-section, like Evette had to have after a long induction, you're going to be on that 5-day mark because your body is so full of like swollen full of fluids and medication. It just has to get all of that out before it can start making milk. So that's totally normal, but you didn't know that at the time.
Yeah. And Alex was like, just keep going, just every 2 hours. And when we're talking every 2 hours, like the baby would wake up, I would feed him in the middle of the night. Like every time I would feed him, I would put the pumps on.
Yep.
Like every time, and even in the middle of the night, 2 o'clock in the morning, feed him, put him back to sleep if I could, pump. And then it got to the point where I was like, I can't do that. Like, I still was so upset. I was like, I can't do this because I have these things attached to me and my son is crying and I can't get him. I can't do anything because I have these things attached to me. And so Alex was like, why don't you try like the breast, hands-free. Right. 100%. That's what I tell every mom. I'm like, get a hands-free pump, because even if you're breastfeeding, right? Like if you're breastfeeding and you're done breastfeeding, then you have to pump after that. And then what happens when your baby starts crying? What do? Like, you're just like, whoops, sorry, hon, I got this stuff attached to me. And, or you hold him from afar.
Yeah.
Shh, it's okay. It's okay, baby.
You're like trying not to spill your milk. You're like,
don't spill the milk, but you're over here. And then, but when you get those, it's just like, I could literally, it was almost like my body felt like it was breastfeeding. Not in that way, but because I'm smelling him, I'm kissing him, I'm loving up on him, I'm giving him, loves. And then the first time I showed Alex too, the first time I was like, Alex, oh my God. The first time I pumped in those, like, it's the stress too. It's the stress of wanting to like not having enough, like, oh my God, I only got an ounce. Alex, like, an ounce is normal. But then when I got those, the stress that I didn't have, plus I was able to hold him, I did almost double. I pumped almost double of what I normally pump. I was like, oh my God, this is amazing.
Yeah. Well, one thing that is, because you were holding him and smelling him, that's something that I tell moms that are having trouble with pumping, like at work or when they're away from their baby. I'll say, watch videos of your baby, look at pictures of them, bring a blanket that smells like them, all that, because it will help you to make more if you are near your baby. But if you're not near them, you can mimic that sort of like feeling. Because that's really important. It can really make a difference in how much milk you make. And then also not looking at it makes a huge difference. They actually did a study on this, and they had some moms pump and have it open and check. And then some put socks over the bottle so they couldn't see it. And the ones that didn't look made more than the moms that were panicking about how much was coming out.
I believe that.
I recommend so it being inside, it being more comfortable, you being happier, all those things, like all of that leads to a better experience, and then more milk at the same time.
What do you suggest to women who, like, because I see women online who are just like, I just can't produce enough. Like, I can't. And they're like, I've tried the cookies. Do those even work? Do the cookies work?
So yes and no. Basically they're called galactagogues, which is like a fun word for like things that may or may not help with milk production. The way that I learned about it was the only way they're going to help you is if you are needing something that they have. So like if you're someone who is iron deficient or you don't get enough protein and then you eat a bunch of these like bars and drinks and like all of that stuff, you're replenishing what your body needs, and then in turn it's helping with the milk production. It's not making more milk. Like it is doing something inside of you to help you to be a better producer. However, most people aren't iron deficient or, protein deficient or whatever. So they eat these things and they're like, why isn't it working? Well, because it's not supposed to. Like, it's kind of a marketing scheme. It doesn't really do a lot for most people. Now, a lot of people need more water or they need more electrolytes. So then they drink things like Body Armor, and it really does help.
Yeah, that was crazy for me. The Body Armor, I was like, whoa.
Because it gives you all of this good stuff that your body needs, makes you more hydrated, and then you're more able to produce a better amount of milk because you're in better health. So those kind of things, that's kind of where that comes from. There are a few things that really do actually increase milk production, but there's not very many like natural sources that do that. It's more like medications like domperidone, which is not available in the US, but like in Canada and things like that, that actually does increase milk production. And then something that you can get here that can help is called Reglan or metoclopramide. It's like an anti-nausea, anti-anxiety kind of medication, but it has been shown to increase milk production a little bit. But some people have really bad, like anxious reactions to it. So it's not safe to just like prescribe to anybody. So, but honestly, yeah, the cookies, the bars, the drinks, the whatever, it's hit or miss. You can try it. I always tell people, try it. If your grandma said that the pink drink from Starbucks helps, go try the pink drink. It's not going to hurt. So go try it. And even if it's a placebo effect, fine. Let it be a placebo effect. It's working. It's helping. So that's fine. Like, it doesn't.
What do you think are the biggest issues as to like why some women can't like produce or breastfeed? Like, what do you think is the reason behind that?
So from practice, because now I've been doing this like all the time for several years, that I have seen hundreds of moms at this point. I would say that there's like 2 or 3 things that I notice the most. As far as science goes, it's less than 1% of the population has inadequate breast tissue. So it's most likely not that you can't. It's most likely not that. I would be able to do an exam on someone and say like, okay, you really don't have milk ducts on this side, or hey, you really have underdeveloped breast tissue, things like that. There are a handful of people that really do have that problem, or they have things like PCOS or other underlying conditions that do cause like a kind of like a block from your body to be able to make the right amount of milk because of your hormones. So things like that, PCOS, absolutely, research has shown us that it does affect milk production in a lot of women. So that is something that I would ask, hey, do you have PCOS? Do you have a history of breast surgery? Do you know any of these things before we get into anything else? Because if we know that, then all of the techniques that I'm going to give you aren't going to work. So if it is not, a anatomy issue or a internal issue, most of the time it is because they're not doing it right. And what I mean by that is nobody explained to them that you either have to be pumping or breastfeeding every 2 to 3 hours all day, not when the sun is up, 24 hours, every 2 to 3 hours. That is the only way that your body is going to make enough milk for your baby. And once you get regulated and once your body has figured out how much your baby eats and you guys kind of get in tune with each other, that can be wiggled. The baby can sleep for longer. You can sleep for longer. You can go to work. You can, stuff like that, where you really don't need to be doing it every 2 to 3 hours, depending on your baby. Some babies are like snackers and they drink once an hour and sit for 5 minutes and then they run off and do whatever they want to do. That's fine. But for your hormones and the hormone production and making milk, you have to pump or feed every 2 to 3 hours around the clock until your milk supply is established. And typically I tell people that's about 6 weeks. So till the 6-week mark, you need to be religious about how often you are feeding that baby, because then your body will get that sort of level and level out on the amount of milk that you need to make. And then you can start playing around with more sleep and, going longer times between things or whatever. But that is the number one thing that they'll say, I'm not making any milk. And I'll say, okay, how often are you feeding your baby? Or how often are you pumping? Okay, well, I didn't pump last night. I've pumped once today and it's 4 p.m. I didn't get anything. And I'm like, you pumped one time today? Like my brain's exploding, but I can't, I have to then have an education session with them that the only reason I'm here is to tell them that they need to pump more. There's nothing else wrong. It's just that they're not doing it enough. And that's
because
exhausting.
Because what tells your body to make more milk
is the removal of milk.
The removal of the milk.
Yeah. So the way prolactin works, like I wish I had a little thing to draw on because it's a nice visual. But the way your prolactin hormones work is you start feeding, your body has a little bit of milk already stored up for the next feeding, right? You start making milk as you go. But once that baby latches and starts removing the milk production happens in the moment that you're feeding. You don't just fill up with the amount that the baby is going to drink. It continues to fill in the milk ducts as that baby is eating. So it is a very like rapid production kind of thing. And with prolactin, what happens is the levels go up and then at a certain point they plateau. So they're going to go to like here and you're not going to get any more. So that's why if you pump for an hour or you pump for 20 minutes, you'll probably get the same amount because it's not going to go up any more than that. It's going to level off. But what happens to get it to go up higher is you want to stop. You want to take a break from the feed, and then it doesn't dip all the way back down. It dips down a little bit and then it goes up more. So at each time you do that, it's increasing like the level of the prolactin so that your body knows to make more. And your body doesn't know to make more unless the baby is on you or unless you are removing the milk via a pump. Obviously, pumping is not as good at removing your milk as your baby's going to be. So a lot of times moms will be like, oh, I fed him, but when I pumped, I only got an ounce. So that means he's only getting an ounce. Is he crying afterwards? No, he seems full. Okay, he probably got more than an ounce, but your pump is only getting an ounce because it's not perfect. It's not a baby's mouth. It wasn't made to do this, biologically. So it does its best, but it's never going to get as much out as your baby is going to get. So honestly, most of the time it is that they are not pumping or feeding enough. Or that they just, have something really small, like a position change, or their baby's lips are folded inwards instead of outwards, so they're not suctioning properly. Like
that was mine.
Yeah. Well, that was you. He had a tongue tie and lip tie, right?
Yeah, that was bad. Yeah.
Also, we had issues with. Am I allowed to talk about your boobs on this?
Let's talk about boobs. Sure, we could talk about my boobs.
Well, there's nothing wrong with your boobs, but just her baby was tiny. Boobs are not.
You could tell.
Baby tiny, boobs not. So that was not a good combination. Most babies can work around large breasts. It's not usually an issue, but because he was born early, he was lower weight, he had the ties in his mouth, it was extremely difficult for him.
But I had that was my problem. I had a tiny baby, an underweight baby, and big boobs. And I had to do the shields. It was the only way. Because it's for somehow, I don't know what about that made it work, but.
Well, because what that does is it just, creates like a smaller area that the baby's trying to get in their mouth, especially with, it's not even about large boobs. It's sometimes about like large nipple areola, but the breast itself, if it's extremely round, it's hard for a tiny baby mouth to kind of like clamp onto that. So the nipple shield just pulls it out a little bit to give it more of like a, flatter shape, which I don't use nipple shields a lot because they can be overused, but for large breasts, for inverted nipples, for babies with ties that can't be revised right now, they're great. They're such a great tool to like help us keep the breastfeeding relationship up in the meantime of figuring out what like the bigger problem is. But
I had to wean him off of it. I had to get him on, get him to latch, and then slip it out. And eventually we got past that. Yeah. But it did.
And nipple shields are also extremely helpful for moms that were not able to latch at the beginning due to like baby being in the NICU or, things like that. And then transitioning them to breastfeeding because now all they've had is like silicone or, plastic or whatever in their mouth with the bottle nipple. So you try to put skin in their mouth and they're like, what is that? I don't want that. So using the nipple shield is like a transitional from the bottle too. So you can use that because it's the same material as the bottle nipple. And then you can slowly try to do like you did and like slip it off of them so that then they get used to it. It takes a lot of patience to breastfeed because there's so many little things that you don't learn about beforehand that can happen. But yeah, I mean, that's my number one problem. The number like 2 or 3 problem would probably be like ties, latch issues, that kind of stuff. But most of the time, I would say it's just not enough education to the mom. Almost always. It has something to do with her not getting enough information and knowing her body and how this is supposed to work and things like that. They just truly don't know. And so it is more often than not, my appointments or education sessions more than I don't put my hands on people. I was going to mention that when Evette was talking about the hospital IBCLCs, because they do have a reputation for being very touchy.
Rough.
So rough.
Yeah,
they're like, do this and do that and do. Now, to their defense, they've probably never worked outside of the hospital. So they're just going based on what they've learned in the hospital, which is a totally different practice than outside, because they only need to know for the first 3 days of a baby's life how things go. They don't need to know what happens after that. So they're not doing it to make anybody upset. But one of the things that I do in my practice is I try to stay hands off unless I have to touch you. And that's only if like I need to evaluate the baby's mouth, if I need to help you assist like with latching, if I need to, examine you, if you have like a thrush infection or you have like, something going on, I need to actually feel the lump, if it's a clogged duct, whatever. But I always say, is it okay if I touch you? And then I explain what I'm going to do. I'm going to palpate right here. I'm going to open your baby's mouth and check for ties, because I know I can't tell you how many moms say, the lactation consultant at the hospital just assaulted me and put my baby on, and she just threw her on there. And I'm like, I'm not going to do that to
you. The lactation consultant who came to my house after my youngest was so different from in the hospital, but literally all she did was sit with me for 2 hours and just teach me. When the baby would be screaming, and she'd say, just let him find you. He's looking for you. And it was literally, she didn't put her hands on me. It was just, let me teach you what to do. And just let me teach you like what he's doing right now. And it was so amazing how 2 hours of just learnings. I breastfed my first 2 kids and had no problems. So to have this baby who would not latch on, and it was something completely different. But it was all just like learning. And I took copious notes, and I used to not love it, but when I'd have friends, he'd be like, oh, my baby won't latch. I can't latch. I'd be like, hold on, let me get my notes. Let me teach you what.
Let me help. Yes.
Alex.
Yes.
Is there any other advice that you would have for a woman who is breastfeeding and struggling? What's the biggest take home that we should have from this?
That's a good one.
Or even with like, I would be interested in like your BRCA experience too. Like what, just like, what advice would you give on both subjects?
Okay. Oh, one thing I realized that I forgot to talk about was there's one more thing about the breastfeeding BRCA thing that I didn't mention. And that's after my first son, I was only about a year and a half out from mastectomy. But when I had my second son, I actually did make a little bit of milk. And that's because each time you have a pregnancy, your body can regrow tissue, because there's stem cells that flow back and forth between you and the baby. And so I did regrow some breast tissue. So I was able to breastfeed him with I still use the thing, but I made like drops. So he did get some from me. Cool. And then with my daughter that I just had, I was filling little syringes with breast milk, because with her, it was the 3rd time now. So more breast tissue had come back. So I was able to kind of like nurse her and use the little thing. But a lot of times I would just nurse her until she got whatever out of me. And then we would use the bottle after that, because I made so much after her. I mean, so much. But for me, it was like, oh my gosh, I got like a whole little tiny medicine syringe full of milk. Like, whoa, this is so exciting. But that is something with women that have had mastectomies. They don't tell you that can happen. Panic. When that milk started leaking out of me with my second child, I called my surgeon and I was like, hey, something terrible is going on. And I think I have cancer. There is stuff. And I was so scared. And he was like, no. I'm so sorry. I'm sorry. He's like, and he explained the whole like stem cell thing to me. And he was like, I'm so sorry. Somebody should have told you that. But he's like, not enough of our patients have babies after mastectomies. So he was like, it's really not something we talk about most of the time, but I will make sure that it is in our like patient education going forward, because I don't want somebody to like go through this. But then when I knew it was safe, I continued to feed him. And then with my second or with my third, child, same thing. But I was just like, absolutely, oh my God, something is wrong. Why do I have milk? I don't understand. And he was just like, it's okay. So that is something fun that I learned.
That's cool.
As far as, going back to the other question, I just wanted to say that because there are moms that have had mastectomies that don't realize that can happen to them. And I love to share that because it's cool and you get to kind of give them a little bit that you didn't know that you could give. If you come to the point where, something like that happens to you, where you find out you have a mutation or you find out that you have breast cancer and you have to have a mastectomy, or you have to have a lumpectomy or things like that, because lumpectomies can also affect your milk supply because they do kind of just cut into the tissue at random to get out the mass, and that can cut through ducts and, damage things. It's not the end of your journey. Like, it doesn't mean it's the end. It means that it might be different for you, but it's not the end. And there's so many options. Even if you don't get to have a nipple sparing, if they have to take your nipples too, there's still skin to skin. There's still, donor breast milk that's available. You can still kind of experience this journey without exactly the way that maybe you imagined it. Because even moms that don't have a mastectomy, that do have undersupplies or do have, issues like that and can't breastfeed, that could be you. Could you imagine, like, you put off doing this big surgery because you wanted to breastfeed and then you can't?
Right.
And that can happen. So just remembering that you're not the only person that's going through this. There are other people, and all of that. And then when it comes to breastfeeding advice, the best thing I can say is get a lactation consultant to come to your house after you have your baby. The ones in the hospital are on a strict schedule. They are basically told that they have to get you feeding and then get out. It's not their fault. It is their administration that makes them be that way. From what I gathered from a friend of mine who did it and left, she said that I felt like I wasn't helping. I was doing more harm than good because I was just putting Band-Aids on problems that needed stitches. So she said that, but that was the way that they made her work. She was basically told to get them feeding so that they could leave the hospital, and that was it. And so a lot of moms feel like that's their experience, but that's not what they want to do. So just first, don't demonize your lactation consultant because she probably doesn't want to do it the way she's doing it. But two, get one to come to your house. The other thing I highly recommend that most people think they don't need is to do a breastfeeding course before you have a baby. And they make online ones, they have in-person ones. Reach out to a local lactation consultant, because I do private classes. Like, if parents reach out to me and say, hey, look, I haven't had my baby yet, but I'm just really nervous about breastfeeding. Can you just come talk to me and my husband and just give us like a rundown or whatever? That could be so helpful, because then you don't even need to call somebody, because you've learned a couple of troubleshooting tips before you even go into all of this. So that would be really helpful. And then just join like friend groups, find other moms that have small babies, because even if they can't give you advice, they can commiserate with you. And that's kind of part of it. It's just that you kind of feel stuck in your own head when you have a newborn, and just being able to vent to other moms, hear that they also had struggles, can be huge in just helping with your mental health, which will then help with your whole journey in general.
Alex, give us your info for anybody who may want to get in contact with you.
Okay, so exciting news. I just got hired at Lactation Consultants of Central Florida.
Oh, congratulations.
That's who helped me.
Yes. Oh, yes. So they're amazing.
Yes.
So they just hired me to come on. I'm going to be their new, basically student, because they want to teach me the way that they run things. So I'll be like a student lactation counselor for the next few months, and then I'll move into like my own practice, and I'm going to be working with them. So you can find me there. They're going to put all my information up in the next couple weeks, because everything just went through last week. So Lactation Consultants of Central Florida, Amy Bassett is the one who runs that, so I will be under her. So you can always contact her to get me. I would just say reach out there, because I will have my email will be alex@lactationconsultantsofcentralflorida.com.
Perfecto. Thank you,
Thank
Alex.
you so much for joining. I love this stuff. We'll definitely have to have you come back.
So we had a game that we were going to play. Never Have I Ever Mom Edition.
Mom Edition. Okay.
Mom Edition. Never have I ever licked a pacifier to clean it.
Oh, definitely.
Totally.
Really?
Yeah.
100%.
Really? No, I always just ran under the faucet.
What if
you're outside?
And I always had a little clippy clip.
Oh.
Yeah.
Yeah, I just clean that off.
Yep.
Never Never have I ever hid food from my kids.
Oh yeah.
100%, right? Especially the cookies and stuff.
I told them it's spicy. Sorry, you can't have it spicy.
All the time.
You're not gonna like that. You're not gonna.
That's
You're
my
not gonna like
go-to.
this.
That's my go-to. It's spicy.
Spicy. Can't have it.
I have one. Never have I ever told my kids, like, we have, like, when you're trying to get them out the door or something, like, you need to hurry up before wherever it is you're going closes. Something that doesn't close, like, McDonald's, it's almost
Oh, it's
noon.
closing.
McDonald's is gonna close.
I have.
I've done that. I've
Yeah.
done that.
I
Or-
actually just did it the other day with because Ernie was like, "How am I going to get him out of this play area? Like, we got to go home." I'm like, "Tell him it's closing. Tell him it's closing."
Yeah, I do that. I'll say it's closing. Or like the other day they wanted to go somewhere, but it was spring break. So I was like, I'm not taking you anywhere right now. And so I said, it's not open today.
Yeah. It's a lot of the arcade wasn't open earlier.
It's not.
So, just so you know.
Not open.
Yeah.
SeaWorld, not open.
No.
Dolphins are sleeping.
No. Never have I ever been puked on. Not like, baby spit up, but like full blown
projectile vomit.
Yep.
Full blown. Oh, and I gotta tell you, before I had Ezra, puke was the most like I couldn't even look at it. I couldn't smell it. Like it was like, don't puke. Whatever you do, just don't puke. I'm still kind of like that now, like with adults and stuff, but like when Ezra does it, I'm like, oh my God, baby, are you okay? Like, or catching it in my hand.
Oh yeah.
Like
full on done that too. Just no, not on the carpet.
That's right. Hold it in until you get to the bathroom. Never have I ever told my kids that the ice cream truck only plays music when they are out of ice cream.
No, I haven't done that.
Oh, wow. That's a good one. Because I'm going to tell you, Ezra's ears,
they hear it.
They hear it.
They can hear it from a mile away.
Oh my gosh. Alex, thank you so much.
Thank you so much
for joining us. And love you guys and have a great week.
All right, you too.
Bye.
I love you, Mommy.